Whether it's enrolling in Medicare for the first time or renewing a plan, you might be overwhelmed with all of the options. I turn to the experts, Caraline Coats and Dr. Robert Zorowitz from Humana, to help us understand. Thanks, first of all, you guys, for joining us. Caraline, first, who is Medicare for?
Yeah, great question. So Medicare, it's a federal health insurance program. It's for individuals once they turn 65. You may be eligible before 65 if you have a certain condition or disability. But it's a federal health insurance program that is you're eligible for once you turn 65. And there are a lot of different options out there. And it's important to take a moment and figure out what makes sense for you. And now is a really good time of year to make that decision, because we are coming up on what we call the annual election period. It goes from October 15th to December 7th, where you can choose a Medicare Advantage plan that best meets your needs. Or if you're on original Medicare, you can also use that time to choose a prescription drug plan that provides you coverage for this next year, 2024.
All right, Caraline, it can be confusing, a lot of those plans, like as you said. So besides the two plans, how else can you break down those plans?
Yeah, so original Medicare covers your hospital visits, emergency care, and doctor visits. You'll have an annual deductible, and you'll typically pay about 20% of cost after that. And in addition, you'll have to purchase for drug coverage a separate prescription drug plan. So that's original Medicare. Then there are what we call Medicare Advantage plans that are offered by private health insurers like Humana that cover all of that. But they include your prescription drugs, so it's all in one kind of package where you don't pay a separate monthly payment for your drugs, and you also are capped annually on your out-of-pocket expenses. So it covers your doctors and your hospitals and your emergency and your drugs, and it may cover other services that are important to you depending on where you live.
All right, there is a little bit of time out there, but Dr. Zorowitz, a lot of competition as well. What should people keep in mind when choosing a plan?
I would say 3 or 4 different factors. One, is your doctor and the hospitals that you use covered or in network on the plan? Second, are your prescription drugs or your medications covered under the plan? Because as Caraline mentioned, Medicare Advantage plans typically do cover prescription drugs. You want to make sure your drugs are covered under the plan. And you may want to speak with your physician about your future health risks to make sure that the plan is best suited to you. Finally, it's important to look at the Center for Medicare and Medicaid Services, that's CMS, the webpage. They actually list Medicare Advantage plans and rate their quality on a scale of 1 to 5, where 5 is highest quality, 1 is lowest quality. And putting all of this together, your doctors, your hospital, your drugs, future health risks, and the quality of the plan, it would then be possible to limit the plans that you consider to the 1 or 2 best plans suitable for your health needs.
And real quick, doctor, is there a big difference with Medicare Advantage?
There are major differences when compared to original Medicare. Medicare Advantage plans have actually shown that beneficiaries have fewer hospitalizations, fewer trips to the emergency room, and lower readmission rates, among other things. And there may also be some financial protection as well through Medicare Advantage plans compared to original Medicare.
All right, very good. A lot of research to do. Thanks again for joining us, Caraline Coats and Dr. Zorowitz. And for more information on Medicare enrollment, we'll include a link on our website, WCNC.com.